Hi everyone, this is Nurse Anna from nursestudy.net, and here we have 50 NCLEX nursing questions. I tried to cover all the systems in here, so good luck. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. Subject: Growth and development across the lifespan. A 70-year-old client with dementia is admitted to the hospital. The client is confused and trying to leave the unit. What is the most appropriate intervention to ensure the client's safety? A. Apply physical restraints to prevent the client from leaving. B. Assign a sitter to stay with the client at all times. C. Place the client in a room with a window view to distract them. D. Administer sedative medications as needed to calm the client. Answer: B. Assign a sitter to stay with the client at all times. Rationale: assigning a sitter provides one-on-one supervision to ensure the client's safety without the use of restraints, which should be a last resort. Physical restraints can increase agitation and the risk of injury, and sedatives may not address the underlying confusion and could increase the risk of falls. Question 2. Subject: maternity nursing. A pregnant client at 34 weeks gestation presents with preeclampsia. Which nursing intervention is most critical in managing this condition? A. Administering magnesium sulfate for seizure prophylaxis. B. Restricting fluid intake to prevent edema. C. Encouraging high protein intake to reduce proteinuria. D. Promoting ambulation to prevent deep vein thrombosis. Answer: A. Administering magnesium sulfate for seizure prophylaxis. Rationale: magnesium sulfate is the standard treatment to prevent seizures in clients with preeclampsia, a potentially life-threatening complication. While other interventions may be beneficial, seizure prevention is the priority in managing preeclampsia. Question 3. Subject: pediatric nursing. A 6-year-old child with acute lymphoblastic leukemia is receiving chemotherapy. The child develops a fever of 38.5 degrees Celsius (101.3 degrees Fahrenheit). What is the nurse's priority intervention? A. Administer antipyretics as ordered. B. Notify the healthcare provider immediately. C. Increase fluid intake to prevent dehydration. D. Obtain a blood culture before starting antibiotics. Answer: D. Obtain a blood culture before starting antibiotics. Rationale: in immunocompromised children, such as those undergoing chemotherapy, fever may indicate an infection. Blood cultures should be obtained before administering antibiotics to identify the causative organism and tailor the treatment accordingly. Question 4. Subject: integumentary disorders. A client with a stage 3 pressure ulcer on the sacrum requires debridement. What is the nurse's role in preparing the client for this procedure? A. Administering prophylactic antibiotics as ordered. B. Educating the client about pain management options. C. Ensuring the client is fasting before the procedure. D. Placing the client in a prone position during debridement. Answer: B. Educating the client about pain management options. Rationale: pain management is a critical aspect of debridement procedures. Educating the client about available options helps in managing pain effectively and reduces anxiety related to the procedure. Question 5. Subject: hematological disorders. A client with hemophilia A presents with hemarthrosis in the right knee. What is the nurse's immediate action? A. Apply warm compresses to the affected joint. B. Encourage active range of motion exercises. C. Administer factor VIII replacement therapy. D. Elevate the leg and apply a compression bandage. Answer: C. Administer factor VIII replacement therapy. Rationale: factor VIII replacement therapy is crucial in managing bleeding episodes in clients with hemophilia A. It helps in clot formation and stops the bleeding. Other interventions may follow once bleeding is controlled. Question 6. Subject: endocrine disorders. A client with newly diagnosed type 1 diabetes is learning to administer insulin. The client expresses fear of hypoglycemia. What should the nurse emphasize in the education plan? A. Increasing carbohydrate intake to prevent hypoglycemia. B. Recognizing symptoms of hypoglycemia and knowing how to respond. C. Administering insulin only when blood glucose levels are high. D. Avoiding physical activity to reduce insulin requirements. Answer: B. Recognizing symptoms of hypoglycemia and knowing how to respond. Rationale: education on recognizing and managing hypoglycemia is essential for clients with type 1 diabetes. Understanding symptoms and appropriate responses can prevent serious complications. Question 7. Subject: respiratory disorders. A client with chronic obstructive pulmonary disease, COPD, is experiencing increased dyspnea. What is the most appropriate nursing intervention? A. Encourage the client to perform deep breathing exercises. B. Administer a bronchodilator as prescribed. C. Position the client in a high Fowler's position. D. Provide oxygen at 5 liters per minute via nasal cannula. Answer: B. Administer a bronchodilator as prescribed. Rationale: administering a bronchodilator can relieve bronchospasm and improve airflow in clients with COPD. While other interventions may be helpful, bronchodilators directly address the underlying cause of dyspnea. Question 8. Subject: cardiovascular disorders. A client with heart failure is prescribed a low-sodium diet. The client reports difficulty adhering to the diet due to lack of flavor. What is the best nursing intervention? A. Suggest the use of salt substitutes to enhance flavor. B. Encourage the client to eat more fresh fruits and vegetables. C. Educate the client on seasoning foods with herbs and spices. D. Refer the client to a dietitian for meal planning. Answer: C. Educate the client on seasoning foods with herbs and spices. Rationale: educating the client on using herbs and spices can help enhance the flavor of foods without adding sodium, supporting adherence to the dietary restrictions and managing heart failure symptoms. Question 9. Subject: renal and urinary disorders. A client with chronic kidney disease, CKD, is scheduled for dialysis. The client expresses concern about dietary restrictions. What is the nurse's most appropriate response? A. You will need to avoid all high potassium foods. B. Dialysis will allow you to eat whatever you want. C. It's important to follow the dietitian's guidelines to manage your symptoms. D. You can drink as much fluid as you like as long as you're on dialysis. Answer: C. It's important to follow the dietitian's guidelines to manage your symptoms. Rationale: adhering to dietary guidelines is crucial for managing symptoms and preventing complications in clients with CKD. The nurse should emphasize the importance of following the dietitian's recommendations. Question 10. Subject: eye and ear disorders. A client with glaucoma is prescribed timolol eye drops. What is the nurse's priority instruction for this medication? A. Take the eye drops at bedtime to avoid dizziness. B. Do not touch the dropper to your eye or surrounding areas. C. You may feel a burning sensation, this is normal. D. Take the drops on an empty stomach for best absorption. Answer: B. Do not touch the dropper to your eye or surrounding areas. Rationale: avoiding contact with the eye or surrounding areas prevents contamination and potential infection. Proper administration technique is crucial for the effectiveness and safety of eye drops. Question 11. Subject: neurological disorders. A client with a recent ischemic stroke is receiving thrombolytic therapy. What is the nurse's most critical assessment? A. Monitoring blood pressure closely. B. Assessing for signs of bleeding. C. Checking glucose levels frequently. D. Ensuring adequate hydration. Answer, B. Assessing for signs of bleeding. Rationale: thrombolytic therapy increases the risk of bleeding. The nurse must closely monitor for any signs of hemorrhage, which can be a serious complication of the treatment. Question 12. Subject: musculoskeletal disorders. A client with rheumatoid arthritis is experiencing a flare-up. What is the most appropriate nursing intervention to manage pain and inflammation? A. Encourage regular exercise to maintain joint mobility. B. Apply cold packs to the affected joints. C. Administer nonsteroidal anti-inflammatory drugs, NSAIDs, as prescribed. D. Increase fluid intake to reduce joint stiffness. Answer, C. Administer nonsteroidal anti-inflammatory drugs, NSAIDs, as prescribed. Rationale: NSAIDs are commonly used to reduce pain and inflammation in clients with rheumatoid arthritis. Cold packs can also help, but medication is typically more effective in managing symptoms during a flare-up. Question 13. Subject: immune disorders of the adult client. A client with systemic lupus erythematosus, SLE, is concerned about sun exposure. What is the best nursing advice to minimize the risk of a flare-up? A. Avoid sun exposure during the peak hours of 10 a.m. to 4 p.m. B. Apply sunscreen with at least SPF 15 before going outside. C. Wear light clothing to protect your skin from the sun. D. Stay indoors as much as possible to prevent exposure. Answer, A. Avoid sun exposure during the peak hours of 10 a.m. to 4 p.m. Rationale: clients with SLE are photosensitive, and sun exposure can trigger flare-ups. Avoiding the sun during peak hours reduces the risk. Sunscreen should have a higher SPF, and wearing protective clothing is also important. Question 14. Subject: mental health disorders of the adult client. A client with schizophrenia is experiencing auditory hallucinations. The client reports hearing voices telling them to harm themselves. What is the nurse's priority action? A. Offer to sit with the client and provide reassurance. B. Administer prescribed antipsychotic medication. C. Ensure the client is in a safe environment. D. Document the client's report in the medical record. Answer, C. Ensure the client is in a safe environment. Rationale: the priority is to ensure the client's safety. Removing potentially harmful objects and providing a safe environment is critical when a client is experiencing hallucinations with harmful commands. Question 15. Subject: growth and development across the lifespan. An elderly client with osteoarthritis expresses difficulty in performing activities of daily living, ADLs. What is the most appropriate nursing intervention? A. Encourage the client to push through the pain during activities. B. Suggest using adaptive equipment to aid in daily tasks. C. Recommend complete rest to prevent further joint damage. D. Advise the client to increase physical activity to improve mobility. Answer, B. Suggest using adaptive equipment to aid in daily tasks. Rationale: adaptive equipment can help clients with osteoarthritis perform ADLs more easily and safely, reducing pain and the risk of injury. Encouraging the use of such tools promotes independence. Question 16. Subject: maternity nursing. A client at 37 weeks gestation with gestational diabetes is concerned about the baby's birth weight. What is the most appropriate response by the nurse? A. Gestational diabetes often leads to low birth weight in babies. B. We'll monitor your blood sugar levels closely to manage the baby's growth. C. It's important to reduce your calorie intake to control the baby's size. D. Frequent exercise can help manage the baby's weight gain. Answer B. We'll monitor your blood sugar levels closely to manage the baby's growth. Rationale: proper management of blood sugar levels is crucial in gestational diabetes to prevent complications, including macrosomia, large birth weight. Calorie restriction and excessive exercise are not recommended without medical advice. Question 17. Subject: Pediatric nursing. A child with cystic fibrosis is admitted with a pulmonary exacerbation. What is the nurse's priority intervention? A. Administering bronchodilators as prescribed. B. Encouraging increased oral fluid intake. C. Performing chest physiotherapy to mobilize secretions. D. Providing high-calorie, high-protein meals. Answer C. Performing chest physiotherapy to mobilize secretions. Rationale: chest physiotherapy is essential for clients with cystic fibrosis to help clear thick, sticky secretions from the lungs, which can reduce the risk of infection and improve breathing. Question 18. Subject: Integumentary disorders. A client with psoriasis is concerned about the appearance of their skin lesions. What is the most appropriate nursing intervention? A. Suggest using topical steroids to reduce inflammation. B. Encourage frequent bathing to keep the skin clean. C. Advise wearing loose clothing to prevent irritation. D. Discuss the potential benefits of phototherapy. Answer D. Discuss the potential benefits of phototherapy. Rationale: phototherapy can be an effective treatment for psoriasis, reducing the appearance and symptoms of lesions. While topical steroids and loose clothing can help, phototherapy is a more targeted treatment option. Question 19. Subject: Hematological disorders. A client with sickle cell anemia is admitted with a vaso-occlusive crisis. What is the nurse's priority action? A. Administer oxygen to maintain adequate oxygenation. B. Provide hydration to prevent further sickling of cells. C. Administer pain medication as prescribed. D. Monitor for signs of infection and report any findings. Answer C. Administer pain medication as prescribed. Rationale: pain management is crucial in a vaso-occlusive crisis, as it can be excruciating. Hydration and oxygen are also important, but immediate pain relief is the priority to manage the client's discomfort and prevent complications. Question 20. Subject: Endocrine disorders. A client with hyperthyroidism is scheduled for a thyroidectomy. What preoperative instruction is most important? A. Stop taking all medications at least 24 hours before surgery. B. You will need to be on a low iodine diet before surgery. C. Monitor for signs of hypocalcemia after the surgery. D. Increase your physical activity to improve recovery outcomes. Answer C. Monitor for signs of hypocalcemia after the surgery. Rationale: post-thyroidectomy, there is a risk of hypocalcemia due to potential damage to the parathyroid glands. Monitoring for signs of hypocalcemia is crucial for early intervention and treatment. Question 21. Subject: Respiratory disorders. A client with asthma is experiencing an acute exacerbation. What is the first action the nurse should take? A. Administer a short-acting beta-agonist, SABA, inhaler. B. Encourage the client to take slow, deep breaths. C. Place the client in a semi-Fowler's position. D. Administer oxygen via nasal cannula at 2 liters per minute. Answer A. Administer a short-acting beta-agonist, SABA, inhaler. Rationale: SABAs are the first-line treatment for acute asthma exacerbations as they provide rapid relief of bronchoconstriction. Positioning and oxygen may follow, but the immediate action is to open the airways. Question 22. Subject: cardiovascular disorders. A client with atrial fibrillation is prescribed warfarin. What dietary instruction should the nurse provide? A. You should increase your intake of leafy green vegetables. B. Avoid consuming grapefruit or grapefruit juice. C. Maintain a consistent intake of vitamin K-rich foods. D. High-protein foods can interfere with warfarin effectiveness. Answer: C. Maintain a consistent intake of vitamin K-rich foods. Rationale: warfarin's effectiveness is affected by vitamin K intake. Consistency in consuming vitamin K-rich foods helps in maintaining stable INR levels and avoiding fluctuations in anticoagulation. Question 23. Subject: renal and urinary disorders. A client with chronic renal failure is on a fluid restriction of 1,000 milliliters per day. The client reports feeling extremely thirsty. What is the best nursing intervention? A. Encourage the client to take sips of water throughout the day. B. Offer the client ice chips to help alleviate thirst. C. Increase the client's fluid allowance to 1,500 milliliters per day. D. Provide the client with sugar-free candies to suck on. Answer: B. Offer the client ice chips to help alleviate thirst. Rationale: ice chips can help alleviate thirst without significantly increasing fluid intake. This intervention helps the client stay within the prescribed fluid restriction while managing discomfort. Question 24. Subject: eye and ear disorders. A client with diabetic retinopathy is concerned about further vision loss. What is the most important nursing instruction to help prevent complications? A. You should avoid activities that strain your eyes. B. Keep your blood sugar levels well controlled. C. Use reading glasses to reduce eye strain. D. Schedule regular eye exams every 2 years. Answer: B. Keep your blood sugar levels well controlled. Rationale: maintaining blood sugar control is crucial in preventing the progression of diabetic retinopathy. Regular eye exams and other measures are also important, but blood sugar control is the primary preventive measure. Question 25. Subject: neurological disorders. A client with multiple sclerosis, MS, experiences fatigue and muscle weakness. What is the most appropriate nursing intervention? A. Encourage the client to engage in aerobic exercise. B. Suggest taking naps throughout the day to conserve energy. C. Recommend a high-protein diet to build muscle strength. D. Teach the client energy conservation techniques. Answer: D. Teach the client energy conservation techniques. Rationale: energy conservation techniques are vital for managing fatigue in clients with MS. These strategies help clients optimize their energy levels, allowing them to perform daily activities more effectively. Question 26. Subject: growth and development across the lifespan. A 5-year-old child with Down syndrome is scheduled for a tonsillectomy. What preoperative intervention is most important? A. Explain the procedure using age-appropriate language. B. Administer sedative medication to reduce anxiety. C. Encourage the child to bring a favorite toy to the hospital. D. Teach the parents about postoperative pain management. Answer: A. Explain the procedure using age-appropriate language. Rationale: using age-appropriate language helps the child understand the procedure, reducing fear and anxiety. Familiarizing the child with the process can improve cooperation and comfort. Question 27. Subject: maternity nursing. A client with a history of gestational hypertension is at 36 weeks gestation and reports a sudden onset of severe headache and visual disturbances. What is the nurse's priority action? A. Administer antihypertensive medication as ordered. B. Monitor the client's blood pressure and fetal heart rate. C. Prepare the client for immediate delivery. D. Educate the client about signs of preeclampsia. Answer B. Monitor the client's blood pressure and fetal heart rate. Rationale: severe headache and visual disturbances are signs of worsening preeclampsia, which can be life-threatening for both the mother and the fetus. Immediate assessment of maternal and fetal status is crucial to determine the next steps. Question 28. Subject: Pediatric nursing. A 3-year-old child with a high fever and rash is diagnosed with measles. What is the most important nursing intervention? A. Administer antipyretics to reduce fever. B. Place the child in a private room with airborne precautions. C. Encourage increased fluid intake to prevent dehydration. D. Educate the parents on the importance of vaccination. Answer B. Place the child in a private room with airborne precautions. Rationale: measles is highly contagious, and airborne precautions are necessary to prevent the spread of the virus. Isolation is critical in managing and containing the infection. Question 29. Subject: integumentary disorders. A client with severe burns is receiving care in the intensive care unit. What is the nurse's priority assessment? A. Monitoring urine output to assess renal function. B. Assessing for signs of infection at the burn sites. C. Evaluating pain levels and administering analgesics. D. Monitoring electrolyte levels and fluid balance. Answer B. Assessing for signs of infection at the burn sites. Rationale: infection is a major risk for clients with severe burns due to the loss of the skin's protective barrier. Early detection and treatment of infections are critical to prevent complications and promote healing. Question 30. Subject: hematological disorders. A client with hemolytic anemia is experiencing fatigue and shortness of breath. What is the most appropriate nursing intervention? A. Administer oxygen to improve oxygenation. B. Encourage rest and energy conservation. C. Provide a high iron diet to increase hemoglobin levels. D. Monitor for signs of jaundice and liver dysfunction. Answer B. Encourage rest and energy conservation. Rationale: rest and energy conservation are important for managing symptoms of anemia, as the body may have decreased oxygen carrying capacity. This intervention helps prevent further fatigue and promotes recovery. Question 31. Subject: endocrine disorders. A client with Addison's disease is experiencing nausea, vomiting, and abdominal pain. What is the nurse's priority action? A. Administer antiemetics to control nausea. B. Increase the client's fluid intake to prevent dehydration. C. Prepare to administer corticosteroids as ordered. D. Monitor the client's blood glucose levels closely. Answer C. Prepare to administer corticosteroids as ordered. Rationale: these symptoms may indicate an Addisonian crisis, a life-threatening condition requiring immediate corticosteroid replacement. Managing this crisis is critical to prevent complications. Question 32. Subject: respiratory disorders. A client with chronic bronchitis is experiencing an increase in sputum production and dyspnea. What is the nurse's primary intervention? A. Administer antibiotics as prescribed. B. Encourage the client to increase fluid intake. C. Provide postural drainage to clear secretions. D. Monitor oxygen saturation and provide supplemental oxygen. Answer C. Provide postural drainage to clear secretions. Rationale: postural drainage helps to mobilize and clear secretions, improving ventilation and gas exchange. While other interventions may also be necessary, postural drainage directly addresses the symptom of increased sputum production. Question 33. Subject: cardiovascular disorders. A client with a history of myocardial infarction is prescribed a beta blocker. What is the nurse's most important teaching point? A. Take the medication with meals to enhance absorption. B. Do not stop taking the medication abruptly. C. Increase your intake of potassium-rich foods. D. Limit your physical activity to reduce stress on your heart. Answer: B. Do not stop taking the medication abruptly. Rationale: abrupt discontinuation of beta blockers can lead to rebound hypertension, angina, or even myocardial infarction. Clients must be educated on the importance of taking the medication as prescribed and consulting their healthcare provider before making any changes. Question 34. Subject: renal and urinary disorders. A client with acute kidney injury, AKI, has oliguria and elevated serum potassium levels. What is the nurse's priority action? A. Administering loop diuretics as prescribed. B. Preparing the client for hemodialysis. C. Restricting dietary potassium intake. D. Monitoring for signs of fluid overload. Answer: B. Preparing the client for hemodialysis. Rationale: elevated serum potassium levels in AKI can lead to life-threatening cardiac dysrhythmias. Hemodialysis is an immediate and effective treatment to remove excess potassium and manage the client's condition. Question 35. Subject: eye and ear disorders. A client with age-related macular degeneration, AMD, is concerned about losing their vision. What is the most appropriate nursing intervention? A. Reassure the client that vision loss will be slow and manageable. B. Provide information on available visual aids and resources. C. Encourage the client to maintain a high antioxidant diet. D. Advise the client to avoid bright lights to protect their eyes. Answer: B. Provide information on available visual aids and resources. Rationale: providing information on visual aids and resources helps the client adapt to changes in vision and maintain independence. While diet and avoiding bright lights can be beneficial, practical resources are crucial for managing daily activities. Question 36. Subject: neurological disorders. A client with Parkinson's disease is experiencing difficulty swallowing, dysphagia. What is the nurse's priority intervention? A. Encourage the client to eat soft foods and thicken liquids. B. Educate the client about the importance of a high-protein diet. C. Administer medication to reduce tremors before meals. D. Monitor the client for signs of aspiration. Answer: D. Monitor the client for signs of aspiration. Rationale: dysphagia increases the risk of aspiration, which can lead to pneumonia and other complications. Monitoring for signs of aspiration is critical for preventing respiratory issues and ensuring safe swallowing. Question 37. Subject: musculoskeletal disorders. A client with osteoporosis is concerned about the risk of fractures. What is the nurse's most appropriate recommendation? A. Engage in weight-bearing exercises to strengthen your bones. B. Take calcium supplements with every meal. C. Avoid all physical activity to prevent falls. D. Limit your intake of dairy products to reduce calcium loss. Answer: A. Engage in weight-bearing exercises to strengthen your bones. Rationale: weight-bearing exercises are effective in strengthening bones and reducing the risk of fractures in clients with osteoporosis. They help improve bone density and overall physical health. Question 38. Subject: immune disorders of the adult client. A client with HIV is concerned about preventing opportunistic infections. What is the nurse's best advice? A. Make sure to get vaccinated against all preventable diseases. B. Avoid crowded places and people who are sick. C. You can stop taking your antiretroviral medications if you feel well. D. Increase your intake of raw fruits and vegetables to boost your immune system. Answer B. Avoid crowded places and people who are sick. Rationale: clients with HIV are at increased risk of opportunistic infections due to a weakened immune system. Avoiding exposure to infectious agents is crucial in preventing illness. Continuing antiretroviral therapy is essential, and diet should be carefully considered. Question 39. Subject: mental health disorders of the adult client. A client with bipolar disorder is prescribed lithium. What is the nurse's most important instruction regarding this medication? A. Avoid high-sodium foods while taking lithium. B. You will need regular blood tests to monitor your lithium levels. C. Take lithium on an empty stomach for better absorption. D. Reduce your fluid intake to prevent lithium toxicity. Answer B. You will need regular blood tests to monitor your lithium levels. Rationale: lithium has a narrow therapeutic range, and regular blood tests are necessary to monitor levels and prevent toxicity. Clients should also maintain consistent sodium and fluid intake to avoid fluctuations in lithium levels. Question 40. Subject: growth and development across the lifespan. An adolescent client with a new diagnosis of type 1 diabetes is struggling with dietary changes. What is the most effective nursing intervention? A. Provide a strict meal plan to follow. B. Refer the client to a diabetes support group. C. Educate the client on counting carbohydrates. D. Suggest limiting social activities that involve food. Answer C. Educate the client on counting carbohydrates. Rationale: educating the client on counting carbohydrates empowers them to manage their condition independently and make informed food choices. This skill is crucial for maintaining blood glucose control. Question 41. Subject: maternity nursing. A client with a history of postpartum hemorrhage is in active labor. What is the nurse's priority intervention? A. Prepare for an emergency cesarean section. B. Monitor for signs of excessive bleeding during labor. C. Administer oxytocin to prevent hemorrhage. D. Ensure that blood products are readily available. Answer B. Monitor for signs of excessive bleeding during labor. Rationale: monitoring for signs of excessive bleeding allows for early intervention in the event of postpartum hemorrhage. While having blood products available and administering oxytocin may be necessary, early detection is critical. Question 42. Subject: pediatric nursing. A child with asthma is prescribed a metered dose inhaler, MDI. What is the nurse's primary instruction for proper use? A. Use the inhaler only when you feel short of breath. B. Shake the inhaler well before each use. C. Breathe in quickly and deeply after pressing the inhaler. D. Rinse your mouth with water after using the inhaler. Answer B. Shake the inhaler well before each use. Rationale: shaking the inhaler ensures that the medication is properly mixed and delivered in the correct dose. Proper technique is essential for effective medication delivery and asthma management. Question 43. Subject: integumentary disorders. A client with a history of skin cancer is concerned about new moles. What is the most appropriate nursing action? A. Advise the client to avoid sun exposure between 10 a.m. and 4 p.m. B. Teach the client to perform regular skin self-examinations. C. Recommend the use of sunscreen with at least SPF 30. D. Schedule the client for a dermatology consultation. Answer B. Teach the client to perform regular skin self-examinations. Rationale: regular self-examinations can help clients detect changes in their skin early, allowing for prompt medical evaluation and intervention. Sunscreen use and avoiding sun exposure are also important preventive measures. Question 44. Subject: hematological disorders. A client with iron deficiency anemia is prescribed ferrous sulfate. What dietary instruction should the nurse provide? A. Take the iron supplement with a glass of milk. B. Avoid consuming vitamin C-rich foods with the supplement. C. Take the supplement with meals to reduce stomach upset. D. Increase your intake of foods rich in vitamin C to enhance absorption. Answer: D. Increase your intake of foods rich in vitamin C to enhance absorption. Rationale: vitamin C enhances the absorption of iron, which is beneficial for clients taking ferrous sulfate. Clients should be encouraged to consume vitamin C-rich foods, such as citrus fruits, with their iron supplement. Question 45. Subject: endocrine disorders. A client with hyperthyroidism is experiencing symptoms of thyroid storm. What is the nurse's priority intervention? A. Administer antithyroid medications as prescribed. B. Encourage the client to drink plenty of fluids. C. Place the client in a cool environment. D. Monitor for signs of hypocalcemia. Answer: A. Administer antithyroid medications as prescribed. Rationale: thyroid storm is a medical emergency characterized by severe hyperthyroidism. Administering antithyroid medications is crucial to control the excessive release of thyroid hormones and prevent life-threatening complications. Question 46. Subject: respiratory disorders. A client with cystic fibrosis is concerned about the risk of respiratory infections. What is the nurse's best advice? A. Avoid all physical activity to prevent lung damage. B. Wear a mask when in crowded places to reduce exposure to infections. C. Use a humidifier at home to keep the airways moist. D. Increase your intake of dairy products to boost your immune system. Answer: B. Wear a mask when in crowded places to reduce exposure to infections. Rationale: wearing a mask in crowded places helps reduce the risk of respiratory infections, which are common and potentially serious in clients with cystic fibrosis. Other measures, such as good hand hygiene, are also important. Question 47. Subject: cardiovascular disorders. A client with a history of heart failure is prescribed a low-sodium diet. The client asks why this is necessary. What is the nurse's best response? A. A low-sodium diet helps prevent fluid retention and reduces the workload on your heart. B. Reducing sodium intake will eliminate the need for diuretic medications. C. It's important to avoid all processed foods to manage your heart failure. D. Sodium causes your heart rate to increase, which can worsen heart failure. Answer: A. A low-sodium diet helps prevent fluid retention and reduces the workload on your heart. Rationale: sodium contributes to fluid retention, which can exacerbate heart failure symptoms by increasing the workload on the heart. A low-sodium diet is a key component of managing heart failure. Question 48. Subject: renal and urinary disorders. A client with nephrotic syndrome is experiencing significant edema. What dietary modification should the nurse recommend? A. Increase your intake of potassium-rich foods. B. Limit your intake of protein to reduce kidney workload. C. Increase your intake of whole grains and fiber. D. Follow a low-sodium diet to help reduce edema. Answer: D. Follow a low-sodium diet to help reduce edema. Rationale: a low-sodium diet helps reduce fluid retention and edema, which are common symptoms in clients with nephrotic syndrome. Protein intake should be adequate but not excessive, and potassium intake may need to be monitored based on kidney function. Question 49. Subject: eye and ear disorders. A client with glaucoma is prescribed latanoprost eye drops. What is the nurse's priority teaching point? A. Administer the eye drops in the morning to reduce pressure. B. Do not touch the tip of the dropper to your eye or eyelashes. C. These drops may cause your vision to become blurry temporarily. D. Take the eye drops only when you experience eye pain. Answer: B. Do not touch the tip of the dropper to your eye or eyelashes. Rationale: proper administration technique is crucial to prevent contamination and infection. Latanoprost is typically administered in the evening, and consistent use is necessary to manage intraocular pressure effectively. Question 50. Subject: neurological disorders. A client with Alzheimer's disease is prescribed donepezil. What should the nurse monitor for as a potential side effect? A. Bradycardia. B. Hyperglycemia. C. Hypertension. D. Anorexia. Answer: A. Bradycardia. Rationale: donepezil, a cholinesterase inhibitor used in Alzheimer's disease, can cause bradycardia as a side effect. Monitoring the client's heart rate is essential to detect this potential adverse effect and prevent complications.